first important change is that your final exam date changed from Tuesday, June 29th to Wednesday, June 30th. So please make note of that because you're going to be in practicum. So we had our final on Tuesday with remediation due the following Tuesday. Your final exam is going to be held on our regular class day. So that will be Wednesday, June 30th. I've already changed the course outline in Canvas as well as the dates in Canvas. But make note of that because when you get your practicum schedule, you have your ATI that morning. I think it starts at 9, and then you have your final that starts at 12:30. So that's Wednesday, June 30th. I'm leaving your remediation due the following Tuesday, which is July 6th. That's the day after we are off for the holiday on Monday. So that is when your remediation is going to be due. That remains the same. That's the only thing that will occur on a Tuesday. Your final is on Wednesday. So make note in your schedule because that is not what we discussed at the beginning of the class. Next Wednesday, there are going to be 2 representatives from the MSN program at ECPI that want to speak with you. They're going to talk to you at the beginning of class, right at 1 o'clock. So I just ask that you all be on time next week. Even if you're not interested in the program at ECPI, it's always a good idea to get additional information about a master's program, see what they have to offer. I'm pretty sure as an ECPI alumni, you get a discount. They'll probably discuss that as well. They'll discuss the tracks that are available to you. Probably what the requirements are. I believe the last I heard, you have to be employed for 3 months before you apply. You guys know how I feel about going into grad school, but we realize students are going to go directly into grad school, and why not consider staying through ECPI? It's not through our campus. Right now, that program is online. So come with some questions. If it is something that you've been considering, that is your opportunity to ask those questions about the program or whatever it might be. So they're going to talk to you guys next Wednesday, right at 1 o'clock. So please be logged in like a little early so that they can get started right at 1. And they said they'll speak to you for about 30 minutes. So that'll be next week. Next week is week 4. And then week 5, we have class on Wednesday. And then class on Friday. That'll be your second exam, Friday, May 21st, I believe. That's the one on Friday at 1:30. And that's our last class. So we just have 2 weeks left of meeting for classes. Still a lot of work to be done on your part as far as keeping up on the readings, doing your discussion questions while you're in practicum, but our actual class sessions, you've had me now for 4 quarters, will actually be over in 2 weeks. There was a question last week about us doing a review, and I have no problem with that. So before your final, being that you won't be in class for a period of time. And so here is what I was thinking, and I just wanted to have a dialogue with you guys to see if you feel like it would be beneficial. So for leadership, there are 2 practice ATIs. You're assigned one of them for this course that you have to complete and do the remediation for, and then take your proctored. I don't know, we went through some questions last week when we did the case study. I don't know if you all see value in that, in having me kind of help you talk through the questions. But what I was thinking is we could meet, and of course you guys are going to be in practicum, so unfortunately not everybody will be available, but we'll record it. And we can maybe run through the second practice assessment together. What do you think about doing that? And it would be available. You can take the practice assessments as many times as you want. So you can still take it on your own. But do you think that that would be of value to you? And you can tell me yes or no. That's kind of why I want to get your input on that. How do you feel?
I think it would be beneficial
to do it as a group.
Yeah.
Okay. Anybody else have any thoughts on that? You think it would help, maybe not be quite so beneficial? You want something else?
I think it would be beneficial.
Okay.
Since you said there's questions on leadership, like on the NCLEX, so.
Yeah, there is. There is. And that will be, you know, we can try to do it before your final week 11. So it's a refresher for all things leadership, and then get you ready for your ATI. And then obviously on NCLEX, it's not a huge portion of the NCLEX blueprint. Now, in your course outline, I gave you guys a link for the NCLEX blueprint. I would encourage you to look at that so you have an idea of where the greatest percentage of information is coming from on your NCLEX. That kind of helps you, I think, divvy up where you need to spend your time and studying, but it is on the NCLEX. There is a portion of it. So we can plan maybe for like week 10, a day during week 10, which is the week before your final and the week before your ATI. I'll open it so that it's something you can still be working on your own, because your practice assessment for this class opens up the 14th of this month, which I know seems early because you don't have all the content, but you still have to take it early and remediate and all that. But you do not need to remediate on the second one. You certainly can, because it's just going to benefit you on content that you missed, but it's nothing you have to turn into me. So let's plan at some point during week 10 to get together as a group. And I don't know if we'll be able to get through every question, but we can certainly talk through them. And hopefully that will help prepare you for both the final, the ATI, and then your NCLEX, because you'll be taking your NCLEX probably within a month of that. So if you have any other ideas, feel free to share them with me. I'm open to whatever is going to benefit you the most. So we'll make sure we get that done. The next thing I want to talk to you about is I'm hoping there has been some advancement in you guys getting numbers for your Student Nurses Association. It is okay if you have not received them yet. I know it's something that they're actively working on. But what I want to do in the chat is I'm going to post the link, because it's difficult to find the link for students of FNSA to get the free membership. So this is the link. I'll probably end up emailing it out to you guys. So once you have your number, you go online and this is where you register for your free year. And then what I need you to do, I believe on Canvas, I'll double check it, that I made an assignment for it. I just need you to upload proof that you have registered. This is part of your 5% participation grade. So I'll check that it is an assignment on Canvas. It can be a screenshot, it can be a picture, however you can just verify to me that you have registered. I'd rather you not send it in email. My emails just get inundated and I am afraid things are going to get lost and I don't want to lose it. So we'll do it as a Canvas assignment for your FNA. And again, if you don't have your numbers, hopefully soon you will, but if you do, go ahead and just knock it out. So that's the link for that. And then I have had a lot of questions on your resume and your cover letter. So I just want to clarify a couple of things. Jessica, I think, was super helpful last week in letting you know what is important to be in your resume and the setup of it. So, you know, some of you have successful resumes already, but it's like for your previous life. That's why it's important. And that's why we took the time for her to come in to help you get your resume set up for what you're doing now, which is applying for your first nursing position. You've never been a nurse before. You don't have that position. So you have to just tailor the information sometimes already in your existing resume and put it in the format, because like she said, as a hiring manager, we glance at it and within seconds, we are picking up on if this person is even eligible for a potential interview, and recruiters do the same thing. So that's why I'm not saying there's anything wrong with your old resumes, but it's not probably not in the correct format. So follow the guidelines as far as having your clinical experience first. What order do you put all experience in, whether it's clinicals, education, or employment?
The beginning. Like your certificate or clinical hours?
Yep. So clinical hours should be like the first thing that they see, right? And then in what order are you going to list all of them? Because you've had a lot of different clinicals.
The newest to oldest?
That's right. Same thing for your education. The very first one is going to be this program, since this is your, unless you're graduating from somewhere else at the same time. So it needs to be ECPI. Go ahead.
Do we put clinical hours under education heading?
Yes, so you can name it, what
I
it,
was going to say education, ECPI, BSN, and then as a sub bullet, you would put in then clinical hours.
No.
Or
no,
She had it as just directly clinical experience.
at the top.
Thank you.
I
Yeah.
was gonna ask about that to clarify,
Mhm.
like, before I had met with her, I had it all listed, like I looked up, all of like our hours and stuff. But then I had like the course, but on hers it was like just, well, it said job, which that's not really applicable, but like the location and then duties and then the hours. So do we just put the location, or because I had like the course code kind of like, like
Yeah.
NU or whatever, and then I had nursing care of children or whatever it's called, and then is that
That's
good?
my preference, Kayla. You do not need to list like NUR 326 because the course code isn't universal for all nursing programs. And a hiring manager is going to say, I have no idea what 326 is, but I would put care of the adult or look at what your clinical course was called and put that there.
That's what it's exactly what I did, like from the ECPI syllabus. But she said, don't do that. But I just feel like they're not going to know. Like, if I just put O or MC, they're not going to know that that was my med surge versus Nemours and stuff.
Right. So I would put your course and then underneath it. So, she's looking at it. She's not a nurse. So I'm going to have a little bit of differing opinions on some things. I do think you should put the course because as a nurse, I don't care whose resume I'm ever looking at. If they put that it was their obstetric rotation, I know what they did there. If it's fundamentals, we know what students are doing in fundamental clinical. So I would list it by the heading, just like you did, remove NUR, whatever, put the name of the clinical. And then let's say for, and I'm not sure if it's essentials, fundamentals, whatever the wording is, if you were on multiple floors, then you can list those different floors. But what you want is the total number of hours you spent in under that essentials clinical rotation. Then
So
you move on.
Duties though, right?
So the duties,
because it's so, I don't know, I feel like it's so,
you don't really need them because again, as a nurse, I'm going to know what you were doing in labor and delivery. I'm going to know what you did in pediatrics. So not so much. Now, if you did something really extraordinary during that clinical rotation, you can certainly list it. But my fear is that if you're listing all these things that you did in clinical, it's really going to make your resume more lengthy. And we're looking for concise. Okay. So unless you got to do something really, or let's say it pertains to possibly the job that you're applying for and you had the opportunity to do that or observe something, then I would add it in because that will stand out to them that, hey, they at least got exposed to this and that's pertinent for the job that they're applying for.
You don't. He did I've done like 3 urinary catheters. Is that something? Or then like if we started an IV during
you can put those. But you don't have to list like patient assessment. That's a given.
Okay.
Right. Medication administration. We know that's what as a nursing student you're doing. So don't worry so much there. But then I also want you guys to, I don't want everyone's resume looking the exact same. So yes, we are giving you templates, or Jessica gave you templates as far as organizing the information, but you can still make the resume your own. And I've seen some really good ones that are different, and they may have some contact information on the left-hand side versus just at the top. So you can still add your touch. You can still make it your resume, and that may be based off a resume you've used before that you've gotten jobs or had help. Some people get professional resume help for your previous life. Now the only thing I want you to do is take that and you've got to rearrange and tailor it for a nursing job. That's what's different. So you can still put a personal stamp on it. As far as the rubric, it gives you, the listing title headings to use that would help you to organize it. But some of you have like no community involvement. Then don't list that. You don't want to list a heading and put none. Leave it off if you don't have it. But if you do, then this is how you should format it. So maybe not everything is going to be applicable to your resume, but keep it concise. If you find that you're getting to 2 full pages or it's spilling over onto the second page, what can you do on the first to make it a little bit more concise? And it may be your previous employment, you got a little wordy. You listed a little bit too much that you do. Pick 3 or 4 duties that were your most important duties at those jobs, and pick the ones that could be related to having a career as a nurse. Customer service, that's big. Client interaction, that's going to be important. Or how, you wouldn't just want to put had client interaction, but anything that relates to that, because we deal with patients. So you having experience dealing with a high volume of people, that can be related to nursing. So kind of think about your past jobs and what is the most important, but keep it to the minimum. You may have had multiple things listed for previous job applications, but it just isn't going to be relevant to what you're applying for now. Then this resume, after you have a nursing job, needs to be changed and tailored so that that first job really highlights what you did in your first nursing position, but you're just not there yet. So feel free to personalize it. You don't have to use Jessica's template, but you do want to use the order of the information because she has helped you to list it in what a recruiter needs to see first and what's going to be most important. And then make sure somebody's proofing your resume. I think I've told you guys, cover letters, resumes, if they had incorrect information, like another organization that they had applied to and didn't bother changing it for mine. If there were significant typos, sometimes any typos, I did not call them for an interview. And there's like a meme going around about how, life goes on if you have an error on your resume. And that's true. But you have to think things are competitive. And even though that has no bearing on how you are as a nurse, if you're really wanting a position and you were in a hurry to do your resume or cover letter, you didn't take the time to proof it, then that's giving me because this is your first impression, is your resume and your cover letter. That gives me the impression that maybe you don't pay attention so much to detail, or maybe this isn't something that you really did want because you did it sort of last minute or in a hurry. So make sure that you have somebody look at it. And it's hard, just like I've told you in previous classes, it's hard to pick up your own mistake because you wrote it. So sometimes things aren't clear. So switch with another classmate, have a family member read through it and just see if they identify any of those errors. To reiterate for your cover letter, I do want you to find a job. Hopefully it's something you really do want to apply for, so this can be a usable assignment. And I'd like you to address that cover letter for that particular job so that you're able to provide specific information the way the rubric outlines. If you cannot find a contact person, make somebody up, make a name up, and so that you can properly address the individual. But, really take time to do a little bit of a search, and maybe you can use this and just go ahead and apply for that position because you can certainly start applying. I think those were the main questions I've received. What other questions do you have about your resume, your cover letter? Because that's due on Friday at midnight. So what other questions? Because chances are somebody else has the same question.
This may have already been addressed. But when do you and don't you want to put your GPA on your resume? Is there like a certain cutoff or number?
I think, what has Jessica told you about GPA? I think it's probably best practice to not put your GPA. Has she said one way or the other? She didn't. What about, we'll look in the,
With her, I'm pretty sure she said, she's just like, I don't care if you put your GPA. So basically, I guess if it's like, you know, good and you wanna,
you can.
then you can. It's not like,
I
yeah.
don't think it's like faux pas to put it on there. I will look because you guys had, who read the chapter? Well, hopefully you read the chapter because you just took a test. Did it discuss anything about putting GPA by chance? Because I don't remember offhand.
I don't remember if it did, but I was always told by like career services at FSU, if it's above a 3.6, you should put it, and if it's below, you shouldn't put it.
Leave it off, yeah, because you don't want to say I graduated nursing school with a 3.0. Not that it matters, but it's not saying like I'm extraordinary. So I can see, you know, let me look in the book. I want to make sure that it doesn't have a specific recommendation. I would say that as a hiring manager, I never looked at anybody's GPA. You're an RN. If you pass NCLEX, you're an RN. So I don't care if you got a 4.0 or if you got a 3.0. Patients will never ask you what your GPA is. So it's insignificant, because I have had nursing students who did not perform well on exams pretty much across the board. Not everyone's a good test taker. In conversation and subsequently in the clinical setting as a nurse, they are exceptional. So I don't really feel that GPA is always a great indication of your ability as a nurse. You can be super, super book smart and not do so hot in a job or in a clinical setting. So, you know, if you're pulling a 4.0, a 3.8, you want to put it on there, then definitely, I mean, that is exceptional, but I just don't think it's very, very important to have it. What other questions?
Where do our references come into play?
So typically you don't send references with your application. You can put a little note at the bottom of your resume that says references available upon request, but technically you don't have to, because that's a given. If they request references, it's part of the hiring process, you're going to have to supply them. So that, I see it a lot of people will put it, it's not a requirement. For the purpose of the assignment, you do need to have a separate reference page. So don't, like if you're at a 2-page resume, don't put it on the second page. It needs to be removed, because really what you want to do is only send your cover letter and your resume. That is a process. And what they usually are doing now for grad school and jobs is they all have their own portal, and that's how they request references 90% of the time. It's all electronic. They reach out to the person directly. Every once in a while, I still get a phone call for a previous student that they're doing reference checks for, but a lot of them are through like their own portal for the big hospitals, I would say. So they're going to have you enter that information through the portal when you apply. So we want you to have the reference page, have it readily available, because you probably are going to have to submit it at least to a couple of jobs. But you could just send your resume. You don't have to even really reference that they're available upon request, because if you want to move forward in the hiring process, you have no choice. What other questions?
So for the assignment, we would just put the references on the 3rd page. So the resume would be the 2 pages. Okay, thank you.
Yeah, so your resume max should be 2 pages, because it needs to be super concise. You don't have a lot of things that are going to be relevant to nursing. They're going to all be like right there. But some of you have had, you had a very significant career prior to nursing school. So if you go on to 2 pages, it's fine. And then that 3rd page is your references. Hopefully most of you have reached out to any of your professors. And again, if you haven't, you always want to get permission. Please don't put somebody's name down that you haven't asked if they would serve as a reference for you. And then clarify their title. So you should put their correct title. So let's say you're using Dr. Haylett. It should be Sharon Haylett. She's PhD RN. The way that you reference, and for your knowledge, when you become a nurse, you always list your degree first. Your degree can't be taken away from you. So once you graduate from this program, you'll always be a BSN. Nobody can take that away from you. You'll always have a bachelor's in nursing. Then you put your license, which would be RN. So BSN, comma, RN, and then comma, and then any of the certifications that you end up getting, which I'm sure many of you will, that's where the certifications go after that. So degree first. So for Sharon Haylett, PhD, I'm pretty sure hers is a PhD, RN, and then if she has any additional certification. So that's something else you want to clarify with whoever you're putting, just so it's accurate. And you don't put Dr. Sharon Haylett, PhD, RN. That's redundant. It's one or the other. So typically just put their name and then all of their credentials, which will signify that she has a doctorate. So just make sure you look at that, or you may need to touch back and say, what exactly is your credentials, and make sure you put them in the correct order, because a lot of people list RN first and then they put like MSN or BSN afterward, but that is incorrect. What else?
I was wondering if you wanted us to submit it as a Word document or as a PDF, because I know like resumes sometimes can get funky if they're not in PDF.
Yeah, so I'll accept either one. I do not believe that there is a limit on what file. It will say, so again, this assignment is through Chalk and Wire. You're not submitting it through Canvas. I do not believe to this point you've used Chalk and Wire. So if you go to our Canvas page for the course, under one of the modules, there's training for Chalk and Wire. So you need to look at that prior to submitting at the last minute on Friday. It goes to Chalk and Wire. I do not think that they limit the file. I don't care. But once you upload it, try to look at it and make sure it formatted correctly. So if you feel that PDFs are usually more reliable, then that is what I would submit it in. But it does not make any difference to me which way. Anything else?
I have a question for you.
Sorry.
Okay.
I have an AA, an ATD, and a previous bachelor's. Should I include the AA and the ATD, or just the previous bachelor's?
What's an ATB?
ATD, it's Applied Technical Diploma.
Oh, no, you can certainly list those. So like on my resume, because I have an ADN, a BSN, an MSN, and a DNP, you list them all. So you can list all of your degrees at any level.
Okay, thank you.
Yep, just make sure they're in reverse order. And you should put, the name of the university or college, the city and state that college is in, and the years attended. That should all be there, and obviously the degree. Any majors, any minors should be listed as well. But yeah, and brag about all the degrees that you've earned. And someone else had a question. I just didn't see who it was.
Yes. If my resume go to like 2 pages, should I put my name and my contact number as like a header so that they can refer? It's also like a continuation for page 2.
So instead of putting the header again, what most of the time they will do is they have a footer. So if you have multiple pages, then you would put, like typically it would be your last name, page 1 or 1 of 3, page 2 of 3, and then page 3 of 3, because you have to have a 3rd page for a reference. That way they know that they should have 3 pages that belong to you. But if it has your name, if it has VU 1 of 3, then they know if they drop it, that they can bring it back to you as the candidate. But usually it's a footer. And if you look at what Jessica, did she email it out? Did you guys get a template, the one she was sharing with you and all that? You have not gotten it.
Yeah, we have it. I just downloaded. There are 3 resume samples. So
How'd you get that?
It's from her email. Her email had 3 attachments. resume 1, 2, and 3 samples, and they can use that as a template. That's what I was assuming.
Yes, that is correct. So if you have not received that, Steve, would you mind if I have the people who haven't received it put a message in the chat? Would you forward that to them?
I can try to copy it and see how I can get it in there. Yeah. Yeah, sure.
Yeah, if she sent you an email, you can just forward, as long as it's not personal. If it wasn't, yeah, you can just forward it to them. So if you have not received that, if you'll put your name in the chat, and then because I don't think she sent it to me. So I'll and if not, if you can't do it, Steve, then I'll ask her to resend it. But I do want you to see that, because, and I'm pretty sure hers have footers. That's pretty standard. And make sure if you use the template that you change the footer. I can't remember what the default is on that. I think it says sample. So your page 2, if you don't change it, it's going to say sample. And that's not your last name. So make sure you change that if you're using it.
Just so people know, it's an email that was sent on April 28th, 2021 at 5:03 p.m. to everybody, to the cohort. And it has Judy's sample resume, 3 of them. Hello, cohort 26, resume examples attached.
Okay. And what was that date one more time?
It's dated, if you do a search at the top in your inbox for Regatta Jessica, you'll find her.
Okay.
So that's the way I find things. And so it's dated April 28th.
Okay.
And I have 3 emails from her. One was April 9th, and the other one was April 5th. So I have one on the 5th, the 9th, and then finally the one with all the attachments.
Okay.
So I suggest just searching inbox.
Yes.
Because it went to the whole cohort.
So just if you'll take a moment and check for that, and if you still don't see it, I see, Rebecca, that you have it, which is excellent. Then go ahead and put your name in the chat and we'll get it forwarded to you. But hopefully everybody has it. Every once in a while, somebody's name gets dropped from the cohort list. I haven't really seen it too much with your cohort, but it can happen. Okay. Other questions? So once this assignment is submitted, I don't always get to look at it immediately. So what I'm going to ask is, if you have a interview coming up, please contact me and let me know that my interview is in a week. That way I can go ahead and grade your cover letter and your resume. Hopefully you all won't have an interview within 1 week. But if you have it coming up, then I need to try to get your feedback to you. So if there's mistakes or anything, you can get it corrected. But it usually does take me some time, just because kind of happens all at a busy time with med surg and exams and all of that. So I don't mind at all. Just say, I've got an interview. Can you please look at my assignment? And I'm happy to do that. Any other questions? I think that is all of my info that I had for you. Alrighty, so let's go ahead. I'm gonna do attendance. Hopefully most of you had some time to get home. I extended it so that you would. I try to keep you guys out of 5 o'clock rush hour traffic if I can help it. Tommy. Okay. Samantha.
Here.
Thank you. Ada.
Here.
Steve. I just heard you. Rebecca. Rebecca. Bueller. No, Rebecca. Amy.
Here.
Heather.
Here.
Lee.
I'm here.
Thank you. Alexis, I see you. Kendrick, I see you. Uma, I see you. Anne Marie.
Here.
Thank you. Emily.
Here.
Stacy.
Here.
Melissa.
I'm here.
Thank you. Andrew.
Here.
Yvonne.
Here.
Grace.
Here.
Allison? Was that Allison? Okay, I see.
Here.
Taylor?
Here.
Vivian?
Here.
Taylor? Taylor R? Amber?
Here.
Kayla? I see
Here.
you. Mira?
Here.
Stacy? She just,
I'm here. I just put a message in the chat that I'm having connection issues on my phone, but I'm here.
you're here. Okay, thank you. Logan?
Here.
Ashley?
Here.
Michael?
Here.
Maggie?
Here.
Kiyomi?
Here.
And Tom?
Here.
Okay, last time, Tommy?
Yeah, I'm here. Thank you. I just got to my head traffic on the way.
Okay, and Rebecca? I know, Rebecca, you're here because you text. No, Rebecca. All right.
Professor Willing, it's Taylor R. I'm here. I'm also having connection issues.
Okay, thank you. All right. So what we're going to do today, and I still got to finish getting some of you guys into a group, is today covers chapters 2, 3, and 4. Chapters 2 and 3 are over leadership, different leadership styles. So you definitely have to look over that information. Chapter 4 is regarding ethics, and that's another really big area of leadership. And you can imagine that there's a lot of ethical issues that come up. You know, we talked about ethics last quarter in research, and a lot of it is very similar. But in nursing and nursing management, a lot of times you're really put in a pickle. You're put in an ethical dilemma because you want to do what's right, you know what's right. And if you're in a management or a leadership role, not only are you trying to be patient advocates, you're in charge of your staff. You have expectations from the organization, from administration above you. So it really sometimes can put you in a tough spot. I know as a nurse leader, one of my biggest issues, and I'm sure some of you see this who are techs, maybe even in clinicals, was in regard to staffing. That was always a big issue for me because I was previously a staff nurse, meaning I had to take care of patients. And you know, or you get to know how many is safe for you to be taking care of. A big push in healthcare is to reduce cost, and that's no surprise. That's the way it's been. But one of the most costly parts of a business is the employees. So where I worked, we were constantly having to work within this Excel spreadsheet generated labor hours. But when you looked at the amount of patients that we were seeing, sometimes what looks great on paper isn't reality. So we know, like with certain surgeries, they're more time consuming. They require the nurse spending a lot more time one-on-one. They can't take more than 2 patients if they're critical. And so for me, I knew how it felt as a staff nurse from having maybe too many patients or being expected to do more than what was either feasible or safe. So I had them to consider. I had the organization putting these labor hour restrictions on us because the more people I had there, then the more money that the facility had to pay out in that same period of time. And it really can be a dilemma because you have to do what's right for the greatest good. And it doesn't always, you can't always make everybody happy, but ethics is a huge component, just like it was in research. So that's what we're going to just briefly talk about. And then what we're going to do is break into groups. And I've already assigned you into groups. I just have to get you guys in, a few more of you into the breakout rooms. And each one of you are going to be given like a case study, an ethical case study. So amongst the group, I want you to talk about it, like how you would handle it, because these are things that you're going to see in your nursing career. So we're going to do that for a little bit. I posted this in our chat, and I've listed the team members here, but again, you'll be already assigned in your breakout room, so you shouldn't really have too much to do, except for whatever group you're in, 1 through 6, that correlates to which case study you'll do. So group 1 is going to do case study 1. Group 4 goes down to case study 4, and they need to talk about this. And then you want to have somebody in your group who's going to lead the discussion, just kind of keep everybody on task. And then if you'll have somebody taking notes, and who's going to, probably the person taking notes would be the person willing to present the information when we come back as a group to discuss this. But you'll get lots and lots of ethical questions, but just in nursing, you need to be able to handle certain situations that are going to come up. Ethical issues, healthcare has changed, and even more so since this book came out, because we're in the middle of a pandemic. So, you know, the nurse leader, the nurse manager is accountable, like I said, to multiple entities, patients, patient families, staff members, organization, their managers. So it really puts people in states of ethical dilemmas where they have to make the best decision possible. One thing to keep in mind, that legal issues are not the same as ethical issues. There can be something that is still considered legal, but that doesn't mean it's going to make you feel good ethically that we carry it out in that manner. So there is a difference. You can have something that is illegal in nursing, maybe not necessarily unethical, and vice versa. So you do need to understand how they are different. Legal is going to be very clearly outlined for you, right? So just think about, you know, rules, laws, statutes. Those tell you, this is what you can do. Boom, boom, boom. If you drive while under the influence and you're pulled over, then that is subject to, depending upon the level, a misdemeanor, a felony, whatever it might be. So they're very clear cut. Ethical issues, not so much. They're more gray. They're more individualized, because we all have different beliefs about certain things based on our upbringing. It could be based on our culture. Our environment can change. So things aren't as clear cut. And some people are very black and white related. They want to know, is it A or is it B? And riding in that gray area can be a little bit uncomfortable. So you just really have to have like a game plan and think of the big picture when you're dealing with something that is ethical related. You want justification of what is right or good. It's kind of like with ethics. It's, you know, treat people how you would want to be treated, right? We've all heard that what do they call that? The golden rule. So you always want to treat people. So ethically, what is the right thing to do, and for whom? Who is that going to benefit? We as nurses, even staff nurses, will be put in these different situations where you're being pulled. You're going to be pulled in multiple directions. You've got the patient saying one thing, you've got your manager telling you it has to be done this other way, and it's not going to sit well with you. Sometimes it's going to give you that feeling of uneasiness. But the way you approach an ethical dilemma and then subsequently solve it is based on your values and your beliefs about what is right. And so that comes with being self-aware. And so you have to do a self-check, right? You have to say, how do I feel about this? Now we have to be careful of how we feel about something and removing bias, because we learned about that last quarter, so it relates here as well. You can't be biased regarding something, but you do need to be self-aware. What are your viewpoints on this? And, you know, I would say a lot of times it comes up with end-of-life issues. And I'll give you an example. There are certain religions that do not accept blood products. Jehovah's Witness is one of them. They will not accept blood products, and that is something that they are very steadfast on. So imagine, and I'm hoping this isn't one of the case studies, but imagine working, you're a nurse, and let's say you work in pediatrics. So you're taking care of your patient. The patient is 7 years old and needs to have a blood transfusion, but based off of the family beliefs, they cannot accept blood products. So I want you, how would you feel about that?
I know I personally would be conflicted because I know that the child needs it. So I would have to really like step aside from my own beliefs and take it into account from their thoughts and point of view.
Yeah, that's great. Thinking of it from their beliefs and their point of view and their wishes, right? And so most of the time they, you know, they identify that at the beginning before anything, that these are our wishes. We don't accept blood products. There are certain sutures you can't use. I think I shared with you all at a surgery center, not mine, but one of our sister centers, that piece of paper was turned in to the receptionist and put in the patient's file, but it wasn't noted. It was kind of underneath all their demographic information. Long story short, in the operating room, they got blood products. So, you know, that's an issue in and of itself. But if you're taking care of this little child who is very sick and desperately needs to have blood transfused, which you've done many times, and it improves the patient's outcome. But they, you know, the family doesn't want it. You just have to really think about how you would feel in that situation. So I think that's an example, a good example of an ethical dilemma, in that you know what's good for the patient medically and how that treatment could potentially improve them. Sometimes it can be a life-saving measure, but it is against the family's beliefs, which is different potentially from what your beliefs are. So I wish I could come up with more examples, and I'll try to, but that's one that you may encounter, and it can cause conflict. So moral indifference is when individuals really start questioning why morality is even necessary in practice. So indifferent, you're indifferent, you don't care either way. If you're under moral uncertainty, at that point, you're not really sure which moral principle applies to the situation, and you may be uncertain as to what the actual moral problem is, but you know something is off. And then moral distress is where you have two scenarios, each one of them equally stinks, and you have to make a decision and pick the one that's going to be the right course of action. So it's like picking the better of two evils. So that can make things a little bit difficult. Or potentially, you know what's morally right, but it's against what the hospital or what management is telling you to do. So now that causes the person to have moral distress. So in the situation that I just explained about the little boy needing blood transfusion but can't have one, which one of these do you think that you would potentially be feeling?
Moral distress.
Moral distress, because you, as a nurse, and in your training and potentially your beliefs, like let's just say if you were self-aware and your religious beliefs say you can accept blood products for life-saving measures, and then not being able to do that, you can't take what you consider to be the right course of action, it can cause moral distress versus some of the other ones. So ethical dilemma, making a choice where, again, you got two, neither one's a great decision, but you have to decide on one of them. Being self-aware is critical, and that is a main component in ethical decision making. So you really have to be in tune with you, your beliefs. It's going to affect your practice as a nurse, and many, many different aspects of management, where many of you are going to become charge nurses. You're going to become directors of nursing. And you really have to be in tune with yourself and your beliefs and be able to set aside biases. And you have to really be cognizant about taking the time to think about it and say, is this my belief? Or is this, if I make a different decision, am I truly doing what's best for the patient?
I was just gonna like add really quick, because I've been thinking about that just the more we've been talking about it. And like, I mean, I'm Catholic, and so to me, like, yes, I don't, that's not something that I believe in, is, not getting blood transfusions. But there's also like practices that I have that other people probably are like, that's weird. So that was something that like helped me kind of, I don't know, just respect. Like, it just kind of goes down back to like a respect thing.
Absolutely. And
I would want someone to respect me and like what I believe in and stuff. And then, so who am I to tell you that you can't? Because if you question me, I would probably feel the same way.
Right. And Kayla, that's part of being self-aware. You know what your beliefs are, you know your mindset, but in a situation, yes, that's how you feel. Those are your beliefs. But in a situation like what I described, we have to set that aside. And that's a great point in bringing up that it could be something in the future that you don't believe in. And would you want somebody making you feel bad potentially for making a decision based off of your values and your culture? And it goes back to being culturally sensitive, what different cultural beliefs are. And I'm going to tell you, I've taken care of patients from other parts of the world, and we aren't always knowledgeable about their beliefs and the way that they make decisions. So I had a patient, and I don't remember what country she was from, but she was from somewhere in the Middle East. And in their culture, very commonly, the women do not speak for themselves. The spouse, the man, is the one who speaks. And, we're always taught in nursing school, talk to your patient. So as long as they're competent, even when I had kids, when I took care of kids, I still talked to the child rather than always talking over them. I mean, obviously, the person we're gaining information, the most of the information from is the parent or the guardian, but you always talk to the patient. So sometimes it's a little difficult when you're asking the patient, you want to hear the patient. Are you in pain? You want to hear from them. What are you feeling? And somebody else is answering. And on our side, if that's not your culture, it kind of feels like, the spouse is being super overpowering and talking for the patient and not giving her an opportunity, where that is completely normal for them. And that is just how in their culture they deal with any sort of decision making, medicine, medical treatment, and you have to respect that. And so knowing how you feel about something really is the first step. So just, be thinking when you're put in these difficult situations, be like, okay, how do I feel about this? Where does that come from? And now, how is the patient, if I were the patient, kind of take it from their viewpoint as well, and that will be helpful. So you'll go through this. Principles of ethical decision-making. Do these look familiar to you? I sure hope so. Autonomy, beneficence, very similar to the same things that we talked about in research. So as far as protecting research participants, we're protecting patients. And a lot of the same concepts apply to both. I mean, the definition of autonomy is the same no matter who you're talking about. So we always want to promote autonomy in our patients. We want them making decisions for themselves. We advocate for them, but sometimes that is reminding them that they have the decision to make, whether it is that they want to do one treatment over another. They have the autonomy to make a decision of no treatment. Some people have had a very long road of dealing with a medical disease, and they're tired. They've kind of felt that they have exhausted most avenues and they don't want to go through it anymore. That is their right. And as a nurse, you may feel if they just keep pushing, if they just give this a chance, they have the right to say no more. And we have to be able to respect that. So we want them to have autonomy up until the very last moment, have them make whatever decisions they can. And we talked about in med-surg and stuff, we talked about different diseases where they may not be able to make these big decisions, right? So they may have what's known as the healthcare proxy. But if they can make it a simple decision, do you want an orange or an apple? That's not, earth shattering. It's not the end of the world, but it's giving somebody an opportunity to have a decision making part of their life. And that can go very, very far for somebody whose independence has been stripped from them when they're hospitalized. That is usually the hardest part for hospitalized patients, is they lose independence. They have to wait on the nurse to bring the pain meds. They have to wait on somebody to fill their water jug, things like that. And it's very difficult for people. So give people options to make decisions, but they certainly have options about their healthcare. Beneficence is doing good, right? So when we do something, we are doing it to promote good. And that's part of the oath we take as nurses, right? Do no harm. We want to do good for our patients. We want to do the best that we can. Same thing for research participants. Paternalism. So you see the word paternal, right? So you think of like a paternity test, right? The male figure in history has been seen in traditional settings as the decision maker, head of household, right? Times have changed and things aren't always like that, but that's where this word kind of stems from. And that is when an individual starts making decisions for somebody else. It could mean that it's a family member. It could mean that a physician is doing that. So we have to be aware of if somebody is demonstrating paternalism. Justice is treating everybody the same. And that relates to, doesn't matter their gender, their race, their disease process. And that, unfortunately, in healthcare hasn't been the case, especially back in the early 80s when HIV was just being diagnosed. Those patients were treated extremely differently. And they are no different than a patient who is hospitalized for cancer, a heart attack. And so we always have to go back to justice, that we treat all of our patients the same way. It's equal, it's fair. And sometimes we have to remind ourselves about that, because we don't want to be seen as giving somebody treatment that we would not be given to the other 5 patients that we have. Veracity is telling the truth. And that is something as a nurse that, nursing is one of the most ethical professions. And year after year, nursing gets rated as either the most ethical profession or in the top 3. So part of that is from being truthful. And I think I've told you, I've had patients ask me like, is Dr. Smith a good doctor? Like, would you go to him? I never want to lie to a patient, right? So maybe I think Dr. Smith really isn't a good doctor. I'm not going to tell a patient that. They're prepped and ready to go for surgery. So you have to get creative in ways of responding sometimes to patients where you are still remaining truthful without necessarily answering their question. So when patients would ask me that, I would say, Dr. Smith has been coming here for 12 years. He has done hundreds of these procedures. So I'm still providing the patient with truthful information without giving opinion. We don't want to ever lie to patients. If you didn't do something, always own up to it. And I think that's one of the biggest things just in life in general. We all make mistakes. We're all human. And when somebody owns up to it and says, listen, that is my mistake, it goes over so much better than when somebody denies it or tries to cover it up, right? Think of something in your life where that's happened. And you really lose trust, right? You lose trust in that person because it was their fault and they're not taking accountability for it. So always remain truthful, be accountable for anything that you do. You don't ever want to admit to potentially doing something that is going to place blame, but in your day-to-day conversations with patients, you have to demonstrate veracity. Fidelity is keeping promises. So if you are taking care of a patient and you tell them that I'm going to be back in 15 minutes, you need to be back in 15 minutes, barring that somebody down the hall coded. And then you come in and you apologize and you let them know what had happened. But when you keep your promises to patients, that increases their trust in you as a nurse and a provider of care. It goes along with building rapport. And remember what we talked about as far as lawsuits. People are much less likely to bring a lawsuit up against a nurse or against a medical professional in which they have a good rapport with. And so when you do what you say you're going to do and you follow through, they have respect for you, but you're building that trusting relationship that we have to do with patients. That's going to foster their health, their care. They have a better outlook, and ultimately that's going to affect their healing and their progress. So just make sure, no matter how little the promise seems, if you say, I'm going to bring you an extra pillow, bring them an extra pillow. Don't start following through on what you say you're going to do. And I'm sure you've all dealt with people who say they're going to do stuff and they don't do it. I'm queen of writing things down now because I got so much in my head. If I don't write it down, it won't happen. But I truly try to always follow up because I told somebody I was going to do something and I really want to honor that. And so you keep that when you go into your nursing career. Confident.
Really quick, like perspective. Like as someone that lived in the hospital for such a long time, like I know as nurses we have 4,500 things to do throughout the day, and that we're busy, but I know that sometimes, you know, they're like, oh, they probably won't even remember that I had said I would come back and give this to them or do this for them. But like, just if you picture yourself like sitting, you know, in a hospital room, like you're not doing anything. So like if someone says that, like that's all they're going to be thinking about, like until you come back in the room.
Yep.
At least that's how it was for me.
No, that's a great perspective because they're sitting there. They're usually in a bed. And that when you say 15 minutes, they are looking at the clock waiting because they've got nothing else going on. Or maybe to them, they really need that extra pillow. You know, it's really important. And it shows that you care because you told them you're going to do something and then you do it. So that means a lot. And I'm glad that you shared that. Again, that goes back to looking at it from their perspective. To you, it may be like, it was a pillow. Like, I don't understand what they're upset about. It was a pillow. They already have one. They just wanted an extra one. And I forgot to bring it. And you will forget. You're going to wake up at like 2 o'clock in the morning and be like, oh my gosh, I never brought Mr. Smith water. You are going to forget certain things, but you want it to be few and far between because patients are counting on it. No matter how minor it seems, they really are. And from their perspective, just like Kayla said, laying in the bed with nothing to do, they're waiting for you to come back. And when you don't, it's disappointing. It's disappointing. It can get people angry. So always look at it from their perspective. Confidentiality, we know we have to keep patients' private health information confidential. That goes with, you know, you got to be super careful about making sure that you know who the patient has said you can share information with, because you could be doing something innocently or somebody call on the phone innocently and you end up divulging information that they have not allowed. Careful when you walk in a patient's room, if you are going to discuss something about their personal history, maybe you've never seen this individual, you haven't verified that they've given permission. Don't talk about that stuff. Ask, is it okay that we discuss your medical care in front of, you know, after you introduce yourself to them? Be careful. And we've talked about public areas. Be careful in the elevator. If you go down to the cafeteria with another nurse and you're talking about a patient, you have to be super mindful of that. The other thing with confidentiality, and I think I did mention this, but this is a big one, is, you know, you have access to a computer system where you can pull up tons of patient information. Be very, very careful that you are only accessing patients who are under your care, because you accessing information on a patient that you are not assigned to, you've never been assigned to, that is a HIPAA violation. At one of Greg's facilities, there was a physician. I think, did I share this with you? Going into patients' files. Did I tell you guys that story?
No.
Okay.
Yes, he was going into patients' files looking for patients.
Yes, yes. Accessing files of patients who were not his to find patients to see. He has since been removed from the facility, and they can bring legal action against him because it is a HIPAA violation. So, you know, there are things like that. Maybe you have a neighbor who gets admitted, can't pull him up. You find out, you know, Justin Bieber's in your hospital. You can't pull up his file to see what he's in there for.
That's what the lady at Sunrise had said. That, I guess, was it Tiger Woods got admitted to Orlando Health or something?
I think
and
it was.
She said like 7 people got fired or 8 people or something because they were all, and I think it might have been one person that logged on, but then there was like people all around them, she was explaining. So everyone that was around them, and then obviously the person that logged on.
Yeah.
I'll never forget that. But like they said, you can't even look at your own.
No, you have to request it. Yeah, it's your medical record. It belongs to the facility, and you do have rights to your records, but you have to request it.
And you don't get all the notes and stuff. They don't want you seeing stuff like that.
There are some pieces of information that they do not have to provide to you, and it should be complete before they release it. So I would have patients requesting their medical records. They wanted them right then and there, but it doesn't work that way. So if they had had surgery, we have to wait until the dictation came back completed before you can release records. So there's a process to it. But yeah, logging in, and you know, Tiger Woods, he's super famous. He deserves to have his medical information private. There's no reason that these individuals had to be looking and being nosy. Everything you do on a computer system is logged, everything. And so that's a good example of, you can still get in trouble if somebody else logs in, but you were involved with looking at the information. That should not be occurring. But even if it's not a high profile individual, if it isn't your direct patient, you have no business looking at anything related to that patient. So just be careful. Same thing, you know, nurses like to share information with each other about their patients. If that other, you can't do that. You can't provide the personal information to another nurse on your unit who's not helping you, who's not assisting in the care. It needs to be kept private, and you just can get in huge trouble for this, HIPAA violations, all of that. So utility is looking at a group or the majority of the population, and we want the good of the many that outweighs the needs or the wants of one particular person. So when we make decisions and when we look at how we practice, we are looking at how is it going to benefit this population as a whole or the group as a whole versus what is only going to benefit this one individual, but not necessarily be reciprocated to the others. So that's called utility. And then it goes into how to make ethical decisions and problem-solving processes. So you'll finish reading through this chapter on your own. What I would like for you to do, and I know we're a little over an hour, it's 4:10, so if you need to use the restroom, you can. Give me 5 minutes. I'm going to finish putting everybody in groups, and it should be in the group that correlates to the PowerPoint in the chat. And then you'll go into your breakout rooms, answer the case study. So we'll start that at 4:15. I'll bring everybody back in. It shouldn't take you too long. I'll bring you back in at like 4:35, 4:40, and then we're going to go through each of those 6 case studies. So you can go ahead and take like a 5-minute bathroom break, and I will finish the groups.